What type of ataxia do I have? It has been so frustrating with my journey in regards to cerebellar ataxia and knowing what type of ataxia I have, or even finding evidence that I have ataxia at all. I've been to numerous doctors, and all of them said everything was normal. There was no evidence of cerebellar degeneration on my MRIs, and I was genetically tested by Athena Diagnostics in 2005, which came back some kind of inconclusive result. And it was non-specific for ataxia. Well, that has been recategorized as negative. So, but again, it does not necessarily mean I do not have ataxia at all. For some people, it could mean that. But for others, it could simply mean, well, the genetic variant of your form of ataxia hasn't been identified yet. Because, you see, genetics, it evolves over so many years, and it's like a lifelong discovery of different genetic mutations causing a disease. So, and I'm trying to go through it again. However, I do have evidence of cerebellar atrophy, and it seems to be a dominant form of hereditary with ataxia symptoms. Cerebellar atrophy is degeneration or shrinkage of the cerebellum, and a lot of hereditary ataxias result in this shrinkage of the cerebellum because the cerebellum over time degenerates and deteriorates, leading to ataxia-like symptoms that gets worse over time. And mine seems to be very slowly progressing, as it seems, as well so far. According to my MRIs, that many have looked over, said everything was okay. Well, it wasn't. My MRIs from 2008 to 2017 hasn't shown much significant changes in regards to a deteriorating or degeneration. However, my cerebellum is shrunk or smaller in size and has deteriorated. When this deterioration or the cerebellar atrophy had first appeared there is unknown at this time. I just know between 2008 and 2017 I had it. So before that, I don't know when it started or what. But I was diagnosed clinically, okay, with episodic ataxia type 2. A clinical diagnosis is different than an official or actual diagnosis or a definitive diagnosis. A clinical diagnosis is not based on lab results or genetic testing or anything like that. A clinical diagnosis is not 100%. It's just based on observations and the symptoms. It's basically the doctor's opinion on what they think I have. Whereas a definitive diagnosis is the actual result you get. a confirmed diagnosis. And so I just know I have a dominant form of ataxia, supposedly. It has been said for years it's like an episodic form, but again, clinically I was diagnosed with episodic ataxia type 2, and the gene for episodic ataxia type 2 was first identified in 1996. And it's a common and more obvious form of episodic ataxia. And I was genetically tested in 2005. So I'm in the process of retrieving this old genetic test results to know for certain at which I was tested for, as to give me an idea. So I'm waiting on that to come in, and I'll keep you all updated on that. But there is a greater chance I was possibly already tested for episodic ataxia type 2 if it's a common and obvious form of episodic ataxia. It would be one of the first thought to automatically be tested for, along with other common forms of ataxias. So, back in 1995, my other family members were genetically tested for a few SCAs, which is a spinocerebellar ataxia. But the results of this, one was negative, the other one was waiting to come back for spinocerebellar ataxia type 3. However, beyond that, I do not know, because we've had trouble retrieving those results. So, it's just been a lifelong mystery. But symptoms I've personally experienced, some symptoms seem episodic, in nature. My other family members, going down in generations, had a permanent cerebellar symptoms and had ataxic episodes along with it, exacerbations. I think that's how you pronounce it, but a worsening of symptoms that appeared episodic, along with a permanent cerebellar signs in between having those so-called episodic symptoms, a sudden worsening of the symptoms that appeared episodic. So this goes back in my family for generations, and yeah, so, but poor coordination and balance, nausea and vomiting, extreme debilitating vertigo are obvious symptoms that are experienced in my family throughout generations with this. Progressive cerebellar atrophy that gradually gets worse over time, which is when your cerebellum in the back of the brain degenerates and deteriorates. And nystagmus or eye movement abnormalities, visual problems, slurred speech, and all that. So those are just a few symptoms that run in my family for generations.